I'm Dr. Mike, and you clicked here because you may be experiencing some sciatic pain. You may be feeling some sharp pain into your hip, or maybe it's down the low back and travels into the leg, and sometimes it can even go into your calf or your foot. And this is often related to sciatic pain, which is the sciatic nerve is actually the largest nerve in your body. And when that nerve gets irritated, people can experience, just like you, things like burning pain, numbness, tingling, weakness in the leg, and even shooting pain when they stand or they sit up or they walk too long or they sit for long periods of time. And for a lot of people, that starts affecting their everyday lives, probably just like you. Like sitting at the workday becomes uncomfortable, or driving for too long hurts, trying to get out of bed, sleeping, it's really stiff to get up. You know, even things like walking the dog or exercising or playing with your kids, that can all aggravate the leg there. The question is, how long has that nerve been irritated, and why does it get irritated? There's a few common causes that we see. The first common cause is the muscle called the piriformis muscle, and that kind of sits right here. It's deep into the hip, and when that muscle becomes tight or overworked, it can press directly on that sciatic nerve and cause the pain to travel down the leg. The second common thing is called the disc bulge. And in the lower back, the actual disc starts to come out, and when that does, it irritates the nerve, and that nerve actually travels all the way down the leg into the foot, and it's actually connected to that sciatic nerve. The third cause is compensation, and it's compensation for poor posture. When somebody sits for long periods of time and has forward posture or even movement patterns, and the body starts shifting and moves and disrupts the weight or distributes the weight in the wrong way, there's going to be extra stress in the lower back and the hips that often can irritate that sciatic nerve. Momentum, we address these things in three different ways. We do chiropractic adjustments, which are going to help alleviate the individual subluxations of the vertebra, which is that individual misalignment. We also have spinal decompression, which can create space in between the discs to get that bulge back in place. And then we can incorporate functional movement, which is loosening and tightening the muscles, or loosening that piriformis, or trying to help with that compensation that you're experiencing. So either helping with your flexibility, helping with your core strength, and trying to get you to move correctly. Most of the time, the movement is incorrect for such a long period of time that it's hard to get out of your pain. So with that being said, we want to make sure that we correct the problem and not just put a Band-Aid on it, so that you can have long-term relief and make sure that you are doing everything that you want to do in your life for a long period of time.